We are going to start with the journal embryology in first lecture of introduction to embryology. So we will discuss these the stages of human life, and we'll come across with these terms, that is phylogeny, ontogeny, trimester, and viability. So these are your competencies also. Now, what are the stages of human life? So before that, a little bit history about the embryology is that embryological study was first recorded in Greece by Hippocrates. Aristotle was known as the founder of embryology. Leonardo da Vinci was the first person to make accurate drawings of the dissections of pregnant uterus containing fetus. So this is the history of embryology. Now, human development is a continuous process that does not stop at birth. It continues for several years after birth. So, we divide that period into prenatal period and postnatal period. Prenatal period is the period of development before birth, and postnatal is the period of development after birth. Now, in prenatal period, there are three stages in the development of an individual from fertilization onwards. So what are those? That is, first is germinal period, that is first to third week. It covers fertilization to the formation of trilaminar disc. Then next is embryonic period, which is from fourth to eighth week, in which the differentiation of three germ layers to form tissues and organs it happens. And third is the fetal period, that is 3 months to birth. It includes growth of fetus and formation of placenta. Now, postnatal period is the period of development after birth. So, these are the categories. That is, neonatal period is first 28 days after birth, infancy is first 12 months, childhood is from first year to 11 years, adolescence is 12 to 19 years, so adulthood is 20 years onward. So, these are the basically different stages of postnatal period. Now coming to ontogeny. Now ontogeny is course of development of an individual organism from time of fertilization to its mature form. It embraces complete life cycle of an organism consisting of prenatal development and postnatal growth of maturity. After reaching maturity, the organism enters into the period of aging, during which the development becomes retarded and retrogressive changes occur. After maturity comes senility and eventually death. Coming to phylogeny. Now, phylogeny encompasses the evolutionary or ancestral history of a group of organisms. It is the sequence of events involved in the evolutionary development of a species or taxonomic group of organisms. Ascending order of vertebrate phylogeny consists of fishes to amphibians, amphibians to reptiles, reptiles to birds, birds to mammals. Now, if we take the example of the development of the kidney, the three stages are observed, that is pronephric, mesonephric, and metanephric. In pronephric kidney, it appears first in the early weeks of the development in the neck and upper thoracic region. Persist in adult forms of some fishes and cyclostome. Then mesonephric kidney appears in the lower thoracic and lumbar region. It persists in adult forms of some fishes and amphibians. Now, metanephric kidney, which appears at first in the lumbosacral region and persists as permanent kidney, so it is persisting in reptiles, birds, and mammals. So, this is the sequence of the development of the human kidney if we see the phylogeny, that is from fishes to cyclostome to the amphibians, then to mammals, from pronephric to metanephric stages. So, ontogeny, it repeats phylogeny. So, this is the ladder of evolution. Now, ontogeny repeats phylogeny. What is that? It means that the development of an individual organism, that is ontogeny, repeats the evolutionary history of an ancestor, that is phylogeny. Now, coming to the trimester and viability, these terms which are related with the fetus. So, clinically, gestational period is divided into three trimesters: first, second, and third. First trimester is from first week to the end of 12th week, and second is from 13th week to 26th week, and third is from 27th weeks to the end of pregnancy, that is to the delivery of the fetus. Now, in the first trimester, the period of crucial events such as implantation, differentiation of the germ layers, early organogenesis, and functioning of certain organs such as heart, it happens. And in third trimester, stage of overall growth of the pregnancy. If the baby is delivered before 37 weeks, it is called as premature or preterm delivery. Now, what are the common causes of premature delivery? That is diabetes, hypertension, smoking, alcohol, and use of certain medicines by mother. So, from first to third week, the third trimester is basically the stage of overall growth of the pregnancy. So, whatever be the events that are happening in the first trimester, they continue in the second trimester with further development. Coming to the viability of the fetus viability is the ability of fetus to survive outside the uterus. The chances of viability increases if it is born after 20 weeks of gestation. So chances they increase to more than 95%. Then if it is between 24 to 28 weeks, the chances are 4 to 90%, and between 21 to 24 weeks, so chances are less than 40% basically. So viability depends upon factors such as birth weight, gestational age, and the availability of the advanced medical care. Now, it is important to understand that viability is a date of potential but not definite survivability. So, that is a risk basically whether the fetus will survive or not. So, that depends upon the you can say the gestational age. So, this is all about the first lecture of the introduction of the embryology. Thank you very much.